Good evening, everyone, and welcome to Pull Up with Limbs and Things. My name is Dr. Chanel James, and tonight we have Miss Sherene Rodriquez. She is the owner of Let's Communicate LLC, speech therapy. So tonight we're talking about how neurological cases, especially people with, say, strokes, spinal cord injuries, multiple sclerosis, those types of diagnoses, how speech helps. So we invite you to pull up with us and you can confirm something you know, challenge something you don't know, and give you an opportunity to share that information with someone else. Hi, Sherene. Good to have you.
Hi, Dr. James. It's great to be here. I appreciate the opportunity to just, share my knowledge of speech language pathology with, everyone out there. Thank you.
Sure, you're welcome. So tell us a little bit about you and let's communicate.
Okay. Well, I am a speech language pathologist. That's a medical speech language pathologist where we work with adults with neurogenic disorders, speech, swallowing dysphagia with, patients who have suffered a stroke or have Parkinson's disease, just to name a few. And I've been in practice for almost 20 years now in the state of Maryland. I've also practiced for about 10 years in California.
Oh.
I have a passion for working with the older population, so adults. That would be anyone from 18 years of age up to 100 plus.
Okay.
Mhm. And I hold my clinical certificate of clinical competence with ASHA. It's the American Speech Hearing Language Association. And of course, I have my license within the state of Maryland.
Mhm.
I enjoy working with clients inside the home on a private based basis where a lot of times people feel more comfortable having me come into the home
Mhm.
to provide speech therapy services or via telehealth. So my practice provides either one, whatever is most convenient for the client. So yes, my business has been around for about 2 years now. Like I said, I've been practicing for about 20 years, but it's really since the onset of the pandemic was when we actually opened our doors
Mhm.
private practice wise, and we've been doing really well since then. And like I said, we go into the home and provide services, and also via telehealth.
Awesome. So I'm glad to hear you say those things. So let's talk a little bit about how speech therapy works with people who have Parkinson's, like you mentioned. So let's do Parkinson's.
Okay. So with Parkinson's, a lot of times people will notice there's been a change in their vocal intensity, vocal quality, whether it's raspy, breathy, or it's just hard to articulate certain sounds. And so a lot of times when someone comes to me, they'll say, "This is this is what I noticed at the onset of Parkinson's." And so as a speech language pathologist, we work on voice treatments. So I'm actually certified to provide LSVT loud. It's
Mhm.
a I love the program. It's a 4-week intensive voice treatment program, and it's really designed for people with Parkinson's because it helps them to maximize their vocal quality. Like I said, a lot of times people notice there's just, a significant or sometimes just a subtle change in their vocal quality. So we really show them ways to modify how they speak, how to maximize their breath support, their vocal folds, so that they can really just express themselves as in a functional manner as possible. So we definitely focus on the voice.
Mhm.
Also, sometimes with Parkinson's, there's swallowing difficulties. So a lot of times people will say, I clear my throat just when I swallow, or it's hard to initiate a swallow. So we really take time to assess the swallow function because that could definitely put them at risk for aspiration pneumonia.
Mhm.
And then with Parkinson's, a lot of times there's the cognitive component. So a lot of times people will say, I have a hard time remembering sequencing steps, like when the
Yes.
physical therapist is working with me,
Right.
I sit to stand. I can't seem to remember,
Mhm.
retain that, or I sit. a sit to stand or stand to sit, just transfer. So sometimes in the past, I was working in the home healthcare setting. And so I would love to co-treat with the PT or the OT
Mhm.
with my Parkinson's patients, just to, I had a lot of Parkinson's patients in the home health setting. And so we would really work on just collaborating on how to keep them as safe as possible, because our issue was really falls, like
Right.
to keep them from falling. And so it's the cognitive component on that level, and that's what I would really work with, the cognitive, and specifically more like the speech, the
Okay.
clarity of their words. Mhm.
So tell me, if the person, say, has a caregiver and the caregiver is noticing some changes, what are some like specific things that you can tell them to notify you of, to know that they should
Yes.
contact a speech therapist?
Yes. If they are having problems just clearly articulating some, like the sounds and words, they feel like they're mumbling and
Mm.
they can't articulate all of the sounds and words clearly, definitely reach out to a speech language pathologist. We get in there, analyze what's going on, and help them to really move their mouth in certain ways. Because what Parkinson's is, it's a neuromuscular degenerative disease, and so it affects the muscles. For us, it's the facial muscles. Sometimes there's, a flat it typically leads to a flat affect over time, and we really maximize the movement of their facial muscles. A
Right.
lot of times we say, if the client is just, have very little movement of their mouth, that will negatively impact their performance, their
Mhm.
speech.
Mhm.
And so we work with the caregiver. Okay, carry over these, what we call oral motor exercises, to help them. And some other signs that the caregivers can look for would be, as I mentioned, just sometimes there's a prolonged delay of swallow. So they're
Mhm.
holding food and it's hard, it's effortful for them to initiate a swallow,
Mhm.
or they may generally cough. We usually say if a client is coughing 3 times or more out of 10 swallows, that's usually a red flag. Something needs to be done.
Okay.
Maybe it's postural, they're not
Mhm.
sitting up all the way,
Right.
or they are sometimes difficulty managing their saliva.
Mhm.
So we'll go in and evaluate their oral function, what we call the pharyngeal function, the throat, and
Mhm.
then we'll go in there and just see what's going on and see what we can do to maximize. So there's certain throat exercises we can get started on, and then if we need to, we can refer out for a swallow eval at the hospital to further evaluate what's going on internally. And then another area the caregiver could be aware of would be just subtle cognitive changes, just forgetting what to do when they're following through with their activities of daily living.
One of the
They're,
ones I thought of, or I've seen, I should
yes,
say, is people who put on their pants and then they put on their underwear and
yes.
then they put on their socks on top of that. And then
Mhm.
they'll decide, maybe I should put on my shoes.
Yes, and it's that sequencing. So sometimes we find that clients can walk us through the
Hmm.
steps, but then it's a different thing. Saying and doing are two different things, and
Absolutely.
it's hard for the brain to process. Oh, first I do this, then I do that, then I do this, and it's really hard. And so we really, and I love to collaborate with other providers because we're all working as a team
Absolutely.
together to
Hmm.
help maximize that client's independence in the home and safety in the home.
Yeah.
So, yes, sequencing is huge on our list.
Okay.
Mhm.
The other question I had, when you are working with someone and they're choking, is that a sign that they need to see you? This is the person who has Parkinson's.
Okay. Yes and no.
Okay.
Uh, Typically, yes. Now, here's the situation. I have a lot of referrals just because someone has a cold or, they're congested. In the spring, we deal with a lot of seasonal allergies. And
Hmm.
so they're coughing throughout the day. And sometimes that's mistaken for not being able to manage their liquids or
Right.
their textured foods. So we really, we look at that, but then also sometimes it's just not being able to manage their pills. Now, if it's a large pill, sometimes that's a challenge for all of us.
Right. Me
Uh,
included.
right. And they say they're able to swallow food, regular food textures, hard, crunchy foods. Fine, no problem. Manage multiple pills at one time, but it's the large pill. That's not necessarily a swallowing problem.
Hmm.
Sometimes there's just modifications that need to be made. A swallowing problem is usually what you see across the board, pretty much with all food intake. So,
Okay.
yeah.
That's a good way to put it because I find that there are caregivers who, they serve the person the food, but then they walk away and they only come back possibly when they've heard a cough or sounds
Mhm.
of choking. And then they think, okay, I possibly need to see a speech therapist. So thank you
Yes.
for clarifying that.
Yes, yes. And I will say this, with Parkinson's, sometimes it depends on the person, but the rate and volume of the each bite, uh,
Hmm.
you know, because there's decreased coordination.
Hmm.
Sometimes clients tend to put too much in their mouth, so it's hard to manipulate. And that's something to definitely keep your eye on. And what we do is like we will say just verbally remind them
Hmm.
if they benefit from just verbal reminders. If not, hand over hand. Oh, let's take some of that food off the spoon and then see how they do with just a smaller amount. So in their oral cavity. And then just it may be something as simple as that.
Hmm.
And just really making sure that they can manipulate and
Gotcha.
tolerate just a smaller amount. But there's different things that we look at, and it's not always obvious to caregivers. And so it's always a good idea to contact a speech therapist because we're looking at everything. There's overt signs that's not always obvious, and
Hmm.
then there's definite signs that may not be obvious to everyone, but this is what we do for a living, and we really pay attention to every detail when it comes to swallowing.
Yeah, absolutely. So let's talk about strokes now.
Yes.
Anything in particular that you want someone to know about speech that they wouldn't necessarily know just by having a stroke? Now we're
Okay.
talking TIAs to full
Yes.
hemorrhagic or ischemic strokes. Okay.
Yes. So, as a speech therapist, I always want to know what side of the brain has been affected.
Hmm.
So typically we say if the right side of the body is the weaker side, we know we're going to focus on that left. Usually it's the left side of the brain.
Hmm.
And that left side is the language center. And so, a stroke can encompass, it can be on either side of the brain. Um, you know, Currently I have quite a few clients on my caseload with left CVAs. So the stroke is on the left side of the brain. And so they experience speech impediments. So it might be slurring of speech. It may be word finding difficulties. I know what I want to say, but I can't get the word out. That is the hallmark sign, usually, of a left CVA. And to keep in mind, it's so many other variables and everyone is different, but that's usually the number one complaint. I can't get my word out.
Hmm.
And it could be mild, moderate, or severe, where it's across the board. It's hard to communicate.
Hmm.
If someone says, "Are you so and so?" It's hard to say yes or no. Sometimes the comprehension of what is said
Hmm.
is hard for someone to understand. Sometimes even writing your name becomes a
Right.
challenge,
Hmm.
and reading, and that's usually across the board. That's the global aphasia,
Hmm.
where it affects all areas. But when it comes to a stroke, we really want to assess their language, the expression, their ability to express their wants and needs, and then their written expression. Can they express their wants and needs with paper and pen?
Hmm.
Can they read a short passage and comprehend it, follow the directions, first do this, then do that? Are they able to do that? And are they able to formulate their words into a grammatically correct sentence? There's a lot of different things that we look at. But if it's that left side, it's usually that word finding. It's hard for them to gather their thoughts. And sometimes they'll speak in a sentence and then may forget what they're saying if it's super
Mhm.
long. And
Right.
so we work on things like that too.
So
Now,
I have a situation that I want to ask you about. So,
sure.
person who's had a stroke, say 4 years ago, on the left side,
Okay.
left CVA, and
Okay.
2 years later, they then had a right CVA.
Mm,
In terms of speech, the person is nonverbal. What can
okay.
be done there? So they make sounds. They are able to communicate their needs, but it's inconsistent.
Okay.
And the person mostly just has moans and groans, not necessarily audible words.
Okay. So in that case, I would still assess what they can and cannot do. And I know you said moans and groans. And so,
Mhm.
can this person approximate a, a one syllable word?
I
Like
have not heard
translate.
it.
I'm sorry?
I have not heard it.
Okay, so in that case, then we would really look to see what we call it an AAC device, augmentative, we call it augmentative communication device.
Okay.
Can
Hmm.
this person utilize, usually one form is to have a computer where it may just be picture symbols for, I'm in pain. They press it, it would speak for them to facilitate their language. It may be their, and I'm not sure what their expressive abilities are, but they may be able to type, um, or just a simple paper that has basic information that's within their everyday activities where, I need my 2 o'clock meds. They'll point to that picture, or I have pain in my stomach,
Hmm.
whatever it is. But as a speech therapist, we want to maximize what we call functional communication. So whether that's um, approximating certain sounds or using an augmentative communication device or, a sheet or a book where there's pictures in it and they can point and just communicate their basic wants and needs that way. That sounds like what we would do for that client that you're referring to.
Hmm. So, what would you suggest to a caregiver who's trying to communicate with the person that does not have the tools that you mentioned?
Ooh. So, okay, here's what I would do. Definitely yes and no questions.
Hmm.
Are you in pain? And
Right.
then I'm assuming they are able to shake their head yes or no, or sometimes we use hand signals,
Hmm.
right? Uh, Anything we just really want to maximize. Um, with the technology or generation of all these computers, you can even use your cell phone and upload free communication apps where I know there's Link Graphica. Um, there's so many different apps out there where they're
Hmm.
free, and it's Apple is my favorite, by the way, Apple computers. And there's so many free apps that even the caregiver can just upload and say, okay, Mrs. Jones, would you like to go to bed? And
Hmm.
then, just yes or no, or thumbs up, thumbs down, gestures, nonverbal cues, things like that. That's what I definitely would do. Basic minimal things like that. Yes and no questions, pointing in the room for what they need.
Hmm.
Hmm.
Those are good. Okay. Well, thank you for sharing. Let's see. Is there anything specific to any neurodiagnosis that you've seen that you wish someone knew?
Oh, that's a good question. Let me come back to that one because yes, yes, I was just. Let me come back to that one. I will.
Okay.
But
That's
I will say with getting back to strokes,
okay.
with the left side, we have a lot of referrals for word finding. But
Right.
then when we have clients who have had a right CVA, the right side of the brain has been damaged. We see a lot of clients that are impulsive,
Yeah.
right? They may
Oh.
not do things. Yes, they do things that they don't have that filter.
Mm-mm.
If I do this, this will happen. That cause and effect, right?
Right.
Insight awareness, problem solving skills. And so we see a lot of falls,
Hmm.
re-hospitalizations,
Hmm.
things like that. And so as a speech therapist, we work a lot on the cognitive component, not so much the speech, although that can be affected, but it's the memory, uh, stopping to really think, okay,
Safety.
I
Yeah.
know if I stand up without my spouse or without my walker,
Mhm.
I will fall. And so we really do a lot of cognitive problem solving therapy for clients who have right CVAs. I just wanted to make note of that because that is huge.
That is huge.
Sometimes,
That's agreed. Whenever
yes,
physical therapists come in and we hear a right CVA, it's a heightened amount of safety regulations, more so for the caregiver than the person, just because we find that the person may not recall it as often as they need to protect themselves from themselves.
that's exactly right. And I was going to say something else too. Just, yes, impulsivity, just a hard time focusing on the task at hand. We work a lot on eye contact
Yes.
because it's hard for the brain to focus. They're easily distracted with their immediate environment. And I get that a lot. I can't focus. I hear something tapping across the room and I have to go and look at it.
Hmm.
And then with either side, we have, we work on if there's any visual neglect,
Hmm.
whether it's a left side neglect or right side neglect, we work on that. That's one of the things I love to work on. When I was working in home health with the PT, because they would transfer, they would walk down the hall and I'll say, okay, Mr. Jones, now you're coming up on a corner. Remember what you need to do. Show me what you do. So, because,
Yeah.
constantly not bruise, constantly
Hmm.
bruising that,
Exactly.
that
Yep.
side that
Hmm.
the brain just does not recognize in the moment. And so there's a lot of cognitive exercises we work on when it's the right side. I just wanted to add that
That's
component.
great. I'm glad you mentioned it. Okay, you
Mhm.
ready to go back to that
Yes.
question?
Yes. Oh, what I wish. I'm still thinking about that one.
Okay, so tell us a little bit about Let's Communicate from the standpoint if someone wants to contact you or to have your services, are you covered through insurance? All the
Yes.
details about getting in touch with you.
Yes. So if someone is interested in speech therapy services, I have a website. It's called letscommunicatespeech.com.
Hmm.
Feel free to pull up my website. There is a link there to schedule a consultation. It's a free 15-minute consultation, and we talk about what you're looking for me to assess, or if you just have questions about for a loved one. I get a lot of calls for, they have family members that they're just not sure if they could benefit from speech therapy services. So I take the time to answer questions and let them know yes or no.
Hmm.
And so I can be reached on my website. My phone number is the best contact number, which is shown on the screen there. And so the first step I always tell my clients is let's just talk. Let's see what you're looking for,
Yeah.
and see if I can be a fit for what you're looking for. And that's the first step. And I am also a Medicare provider, and I also accept Cigna and Aetna insurances. So
Good.
I'm sorry, no longer Blue Cross Blue Shield or Kaiser, but Medicare, Cigna, and Aetna provider.
Medicare, Cigna, and Aetna. Got it.
Yes, yes,
Okay. Well, that is Miss Rodriguez's information at the bottom of the screen. Feel free to contact her for any of your speech needs. Okay, have we thought about it yet?
I think it's just so much that it's hard to really articulate.
Yeah, it is. That's true. Like when someone answered you a general question about PT, I get it.
Yes,
So let's see if it's what about MS?
yes. So with MS, I really want to make sure their swallowing
Right.
is good.
Hmm.
Uh, because it's the twofold. It's the oral and the pharyngeal. Okay. And
Hmm.
then with their breathing, the speech. And so just we really work on the oral musculature. Okay. The speech, the coordination of their tongue to produce intelligible speech, and then also the swallowing. Because pretty much I'm always looking at swallowing with pretty much every client that I see, there's sometimes subtle changes that the client or the family member may not realize.
Right.
Like I said, going back to the pills, if you notice that, it's just with pills, then that's one thing. But if it's across the board, say, for example, with soup or dual textures, thin liquids and something solid mixed in together, cereal, soups, even fibrous fruits like watermelon, pineapple. If you're choking, if you're coughing, if you're clearing your throat just
Mm-hmm.
when eating those food textures, a speech therapist needs to see you. And so I noticed that it's just that subtle coordination. Um, and it,
Is
like I said,
there, quick question. Is there any, because we know MS has different types. Is there a specific
yes,
type that you should look at that for, or that across the board,
it's
regardless?
really across the board. It's really across the board because it's, a normal swallow it takes 1 second to swallow.
Mm-hmm.
And I think that's just so amazing because everything happens so fast. And so, everything has to move up and forward. The flap comes over our windpipe, and then the food goes down, and then everything relaxes and goes back to its normal resting position. And so it's really across the board. And then a lot of times there's just weakness.
Mm-hmm.
Dr. James, I will tell you this. I have a lot of referrals from falls for swallowing. I get a lot of referrals for swallowing from falls and a urinary tract infection.
Yeah, because people really don't realize how much everything is connected.
That's it. Exactly. And so when we fall, a lot of times we experience what? Generalized weakness in our body, but we forget these muscles are also included. And
Yeah.
so I'm starting to clear my throat when I swallow. Let me take a look. Let's see what's going on. And a lot of times it will remediate, but we need to make sure so that person does not, put themselves at risk for what we call aspiration pneumonia, anything that falls into their lung, food or liquid.
Got it.
Same thing with a UTI, or urinary tract infection. But with MS, it's really the number. I really want to ensure safety of swallow. That's my main concern.
Got it.
And then the speech.
So I know that this is one of those general statements because people don't really know what it comes from. However, what's your experience with Bell's palsy?
So to be honest with you, I've had one person with Bell's palsy.
Mm-hmm.
And, we were working on the facial muscles, strengthening the facial muscles. So the oral motor exercises, the speech was slurred because the mouth wasn't, helping to, shape the sound as before. But there was remediation for this client. We worked now this has been so long ago, but we worked for a few weeks. And this person was able to, I remember we met the goals and it wasn't long at all.
Right.
But I remember the focus was oral motor exercises. We did a lot of those.
So that's been my experience too. I
Mhm.
see some people with Bell's palsy, and so long as we work on those facial muscles, it'll return.
Yes.
However, if it's prolonged where you're not seeing someone initially when it occurs, you could possibly have a delay in return, or the return doesn't come. Is that your experience?
I haven't had a lot of clients with Bell's palsy, but that one person that I work with, it was at the onset. We came.
Yeah,
This was
that
in
makes a big difference.
yes, and it only took a few weeks. I remember I was like, that was quick.
Exactly.
He was what, 50, early 50s.
So let's do a public service announcement. If you have Bell's palsy, see a PT or see a speech therapist for your oral motor facial exercises so that you can regain your function in your face.
Yes.
Okay.
My clients, I've had clients with ALS. That's a degenerative. And, we get in there quick. And our number one goal is to really make sure that they are, just to ensure safety of swallow. Okay. Safety of swallow, and to maximize, what can we do to maximize their speech from beginning to end? We start off. I've had a client where I recorded their voice for functional phrases like he was married, he would say, I love you to his wife a lot. And we recorded those functional phrases. And so towards the end, when he lost the ability to speak, we
No.
had his voice
Yeah.
programmed into that augmentative communication device. And I'm telling you, it was priceless.
I'm sure.
It was priceless.
Yeah.
And so it's those little things that go a long way. And sometimes family, we don't think about those things unless, you have a speech therapist. Let's do this. Let's do that. Even with Lewy body dementia, I've had clients with Lewy body dementia and just family education. Okay, what to expect in each stage, right? Because why I do what I do, I love to educate the caregivers, the family.
Same here.
Yes. And I think that's how we make the patient, as we set them up to be as successful as possible, whether it's maintaining where they are or just, maximizing them to go even further, if there's room for progress, depending on what the impairment is. But I think that's crucial for that carryover.
Absolutely. Okay, well, I think this is good. We've talked about strokes, we've talked about Parkinson's, we've talked about MS and ALS and Bell's palsy and even dementia. So,
yes.
Do you have a final thought for us, generally speaking, about all of those or any neuro cases, period, in what a speech therapist can do or things that a caregiver should be aware of to seek speech therapy services?
Yes. I think that there's this myth about speech therapists in general. We only work on speech, and I tell people, let's debunk that myth. We do way more than that. And I say it's 3 domains: the cognitive, the speech, and the swallowing. And so I think that if the public has an eye or keep their finger on the pulse as to what to look for with swallowing, just that subtle, I'll say it this way: 3 times or more coughing or clearing their throat out of 10 swallows, refer to a speech therapist.
Yes. One more time.
Yes.
If you're coughing
or clearing your throat.
More than 3 times.
3 times or more. Yes. Okay. Yes. Out of 10 swallows. That's just a general guideline. Please, please, please contact a speech language pathologist. I will say this: it's a lot of gray area when it comes to swallowing when we assess and treat. Not to confuse anyone, but there's also the silent indicators that someone is not tolerating. You don't have to just cough, And I'll say this: true choking is when your airway is occluded, right? I grew up with my grandmother saying, raise your hands up, right? That will help open up your airway.
Or hitting your back.
Yes. Heimlich maneuver, though, please.
Yeah. Please.
You don't have to just cough or clear your throat or choke, right? To say that weakness there. Sometimes people will have just their eyes will tear up and stream down their face, or their nose will run just when eating. Their voice sometimes becomes wet or gurgly. That may just be a subtle change like that. And it's not because they're eating spicy food. So definitely keep your eye on that. It's just a tricky thing. You have to be very aware of subtle changes when it comes to swallowing. But I just like to I love to let people know what we do. Like I said, it's more than speech. And I think that we're a help to the adult population because we maximize their safety. If they're at home, if they're in assisted living, a boarding care, we maximize, their, with the caregiver education goes a long way because I'm only there a few times a week and they need to carry it over with the staff or, their family members. So no matter what the setting is, I think it's crucial to have a speech language pathologist to maximize their everyday living abilities.
So true. Okay, I've got one more question.
Yes.
For those people who have acid reflux.
Yes.
and then you find that you are coughing when you change
Mhm.
positions, what is the best thing to do?
So you say they're coughing when they change positions?
Mm-hmm.
Yeah, okay. So acid reflux, my the red flag for me would be, what is their vocal quality like? Because sometimes, with acid reflux, you have that the acid will sit in your throat,
Mm-hmm.
right? You may swallow, but it's still there. And over time, that can eat away at the lining of your vocal cord. So that will definitely change your vocal quality over time. So, first and foremost, consult with the doctor. If there's medication that needs to be prescribed, please take it.
Mm-hmm.
We do a lot of education with what types of foods to abstain from
Mm-hmm.
per doctor's recommendations, sitting positioning, just positioning. You never want to lie flat 30 minutes following a meal. Stay upright for
Mm-hmm.
some time. And we're big on drinking plenty of water, especially when you have heartburn or just, have that acid in your throat.
Mm-hmm.
We're seeing an influx of college students now with acid reflux because late night studying, eating fried, greasy foods, foods have high in acidity,
Right.
and they go right to bed. And so there's an influx. And so that we get voice patients because their voice has been affected over the years.
Mm.
And they never really understood that that's what could happen if you go untreated for so long.
Well, glad you mentioned that.
Yes. And just positioning, stay upright as much as possible, especially if you've had something, with pasta,
Mm-hmm.
chocolate, things like that. We really want to make sure we do everything that we can do to decrease, the symptoms. So we
Right.
do a lot of education.
Okay. Well, I
Mhm.
think this has been good. If you are watching us and you have a question, please leave your question in the chat and we'll answer it. Always pull up with limbs and things is to confirm something you know, to challenge something you don't know, and to give you an opportunity to share that information with someone else. So if you found any of this helpful, please share this information with them. My name is Dr. Chanel James, and I am the owner of Limbs and Things, mobile and telehealth physical therapy practice. We serve aging adults in DC, in Maryland, and in Virginia. Our goal is to help you move from I can't to I can. Our information is at the bottom of the screen. This is Ms. Rodriguez's information as well. Contact us if you are an adult needing speech therapy services or physical therapy services. We both take Medicare, but Ms. Rodriguez also takes Aetna and Cigna. Is that right?
That's correct.
Okay, and we also take TRICARE as well. And
Yes.
we will be glad to help you move to a place where you're able to do things independently and not have any problems with some of these neurological conditions that we've discussed tonight. Thank you so much for coming. Have a good
Thank
night,
you.
everybody.
Thank you so much.
You're welcome.